This is demo 4. We are presenting on the plantar fascia structure and function. I'm Emily.
I'm Andy, and that's Jamie. All right, so the plantar fascia is a connective tissue on the plantar surface of the foot. It primarily stabilizes the arch and supports the body weight during walking and running. It's a very commonly injured tissue. Plantar fasciitis is probably the most common injury to it. So the specific structure of the plantar fascia is a thick fascial aponeurosis on the plantar surface of the foot. It runs from the medial side of the calcaneal tuberosity to the heads of the metatarsal bones. There are 3 segments to it. The first is the medial segment. In the middle is the central segment, which is just considered the plantar aponeurosis. It's kind of the main player, the most commonly referred to part of the plantar fascia. And the third is the lateral component. Kind of an interesting fact is that in children, the plantar fascia connects to the Achilles tendon, but that connection tends to go away with age. We do still see a correlation, though, in adults regarding a tight plantar fascia kind of correlates with a tight Achilles tendon. So there is still a correlation, but not a direct connection.
Next, we're going to talk about the functions of the plantar fascia. The first function is that it stabilizes the arch of the foot. It prevents the arch from separating or collapsing on itself. Then it flexes the first metatarsal, which is the metatarsal that carries the most amount of the body weight. It also acts as a shock absorber for when the foot hits the ground, and it undergoes tension when bearing weight, and the plantar fascia actually bears 14% of our body weight. And then it also performs the Weinless mechanism, so when your toes are dorsiflexed, the plantar fascia becomes tense, and the longitudinal arch elevates while the foot shortens.
We made this model to demonstrate how the plantar fascia undergoes tension when it does weight bearing. So we're going to pretend that the wooden part here is the arch of the foot and that the plantar fascia is this rubber band right here. So when the foot bears weight, the weight will come down and act through the arch of the foot and then creates tension in the plantar fascia.
So next we're going to talk about the function of the plantar fascia during your gait cycle. So there's 4 phases of the gait cycle, which is the heel strike, foot flat, mid stance, and push off. So the plantar fascia elongates during the gait cycle from heel rise to push off, and it behaves like a spring, which may help conserve energy. So first we start with heel strike, where her heel is striking the ground. And then it goes to foot flat, where her foot is flat on the ground. Next is mid stance, where she's shifting her weight onto her foot. And that's when the plantar fascia starts to elongate. And then during push off, when she goes up on her toes, the plantar fascia is fully elongated.
So now I'm going to tell you about a condition called plantar fasciitis. This is inflammation of the plantar fascia across the heel bone. The most common way that this occurs is when the plantar fascia is acting as a shock absorber. Too much tension and stress can cause micro tears in the fascia when it is acting as a shock absorber, and over time these tears can cause inflammation. In other cases, however, the cause is unknown. This causes pain, and it is often the worst in the morning or upon standing after long bouts of sitting. There are several risk factors that can increase your chance of developing plantar fasciitis. One of these is your occupation, and plantar fasciitis is more common in people who spend all day walking or standing on hard surfaces than those who do not. Another risk factor is age. The chance of developing this increases with age, and the most common occurrence is between ages 40 and 60. An additional risk factor is exercise, which is performing activities that place extra stress on the heel, such as running, ballet, and jumping. Additionally, foot mechanics can increase your risk. So this could be an atypical weight distribution due to high arches, an abnormal gait pattern, or flat-footedness. And lastly, we have obesity. So excess weight increases the amount of stress on the heel and its fascia and can increase the likelihood of stressing that out.
So there are quite a few different ways that you can treat plantar fasciitis. Some of them include massaging, stretching, wearing a night splint while you're sleeping, which kind of keeps your foot in dorsiflexion, so it's stretching out the plantar fascia along with the calf muscles. Athletic tape, shoe inserts, different anti-inflammatory medications. Some people end up getting steroid injections, physical therapy, and surgery as a last resort. Most treatment for plantar fasciitis will include kind of a combination of these things, and they'll look a little different for everyone. Things that work for one person won't necessarily work for the next.